The recent outbreak of the Ebola virus has sparked a big reaction in the minds of the people in the U.S. A lot of information has been played in the media since the spread to our nation. Today, we take to the streets to get your opinions and see what the general perception of this Ebola outbreak is. Hello, sir. Do you have some time to answer a few questions about the current Ebola outbreak?
Yeah, I do.
Yes, I do.
Sir, are you aware that Ebola has been reported in the U.S.? Do you know how the virus first came to our country?
I'm aware that Ebola has spread to the U.S., and I think it came here because of some doctor that was treating it in Africa who became infected and brought it back here.
Yeah, I know Ebola that was reported in the U.S. and it came with Dr. Ken, who was treating Ebola in Nigeria.
Do you know where the confirmed cases have been in the U.S.? Where has the outbreak affected outside the U.S.?
I think the reported cases have been found in Georgia, New York, Massachusetts, and Texas. Outside of the United States, I know it's been found in Africa.
Yes, I believe the confirmed report came from Texas, Nebraska, and Georgia, and Central Africa was the most affected area outside of U.S.
Did you know that there are 5 unique strains of Ebola? Do you know which one is affecting us now?
No, I was unaware of that, and I have no idea which one's affecting us right now.
I didn't know there were 5 species of Ebola, but I did know that there is only specific common virus of Ebola that's dangerous.
Do you know the symptoms of Ebola? Do you know how Ebola is spread?
I'm not exactly sure what the symptoms of Ebola are, but I'm pretty sure it's spread through blood and other bodily fluids like AIDS is.
Yeah, I think Ebola has symptoms like flu symptoms like headache, fever, muscle pain, and vomiting. I'm not sure how it spread, but I think it spread through physical contact.
Do you feel scared about being infected with Ebola? Are you aware of who the people at a high risk are?
I'm actually pretty scared about getting Ebola, mostly because all the media coverage on this outbreak. I need to take it seriously, and I'm not sure who's at high risk, so I might be one of those people, and I don't want to get Ebola.
I'm a little nervous because Ebola is a fatal disease. Irrational am I fear because the families of the infected people are at higher risk than the rest of us, plus I live here in Massachusetts, and nobody was reported as infected of the virus, and I don't plan to go anywhere where Ebola was reported actually in the future.
Do you know what doctors are doing to treat Ebola?
I'm not really sure if they are doing anything. I haven't heard anything about a cure. I think there's a vaccine out though, isn't there?
Well, doctors have used untested medicine to treat Ebola, to treat actual patient too, but other than that, I'm not really sure if there's a treatment or cure for the disease. Plus, I think doctors are working on developing some new types of vaccine to prevent Ebola in the near future.
Now that we've spoken to some everyday people, let's get the truth. I have here Dr. Donovan with me, and he's been kind enough to come here today and tell us about Ebola. Dr. Donovan, thank you for coming. Can you tell us the need-to-know information about this current Ebola outbreak?
Of course I can. Thank you for having me, and I understand you hit the streets and have a couple people who are concerned. First things that have slipped through the media is the first person to actually test positive with Ebola in the United States was Thomas Eric Duncan on September the 30th in Dallas, Texas. There have been 3 other confirmed cases since the initial case, but 2 of these were healthcare workers who were providing treatment. So Mr. Duncan was the only person who was not a healthcare provider to be positively diagnosed with Ebola in the United States. There are 5 viruses, 5 strains of the virus that are present. The first one is the Zaire strain, which is the current one and is the most lethal one. There is the Reston virus, which hasn't been found in humans, but it does infect monkeys. There is Thai forest virus, there is Sudan virus, and there is, I'm going to go ahead and say I can't pronounce that even as a healthcare professional, but it's not a common strain of it. So the symptoms are all the same. It's flu-like, there's vomiting, diarrhea, there's high fever, there's muscle aches, and in the end stages there is the common sign of hemorrhaging, which is severe bleeding. Most incubation is about 2 to 21 days depending on the virus. Exposure, as I've heard and as you all have heard, is through direct contact with infected fluids, human fluids. So this is not something that can spread through the air, which is what we see in the flu or other viruses. There is an experimental treatment that was used successfully. It is the ZMapp treatment, and currently a vaccine is in progress. Hopefully more will come next year. As a healthcare provider, though, I am a virologist, and I do have a hazmat suit to show you guys some of the precautions doctors are taking with us if you would like that.
Yes, thank you, Doctor. And now we go to Dr. Donovan, demonstrating how to use a hazmat suit.
Thank you. So the first rule on isolation is you wear scrubs. You don't want your own clothes under this. Second rule is you put on gloves that should fit. These are called your internal gloves. You want multiple sets of gloves. Next, you put on the actual hazmat suit. Now, right now, I can touch the suit anywhere I want because hasn't been contaminated with anything. But as soon as we extract our patient, it will become contaminated. Put your mask on. And your gloves on, and your protective glasses on. Now, what I need to do is you got to put on your boots. Now we're in Boston, right? And I'm already sweating with this thing on, so you can imagine what it's like in Africa wearing one of these. So now, you have to duct tape up my zipper, and you'll have to duct tape on my external gloves. Let's take that up. You don't want any skin exposed. There we go. Put the other one on. You can just kind of get that under. Now, the zipper. Now, anywhere where you see I have exposed skin, because you're my partner in this case. Yep.
And now we go to extracting the patient.
So now we get to go treat our patient. How are you feeling today?
Awful.
When did all these symptoms start?
About 10 days ago.
About 10 days ago. Have you been in contact with any known Ebola patients?
Well, my cousin's from Nigeria, and they came back to America about a couple weeks ago, but they have not. They got tested and they didn't have it. I don't know what's going on.
Well, if they didn't have it, then the likelihood of you having Ebola is slim. Were you in contact with any of their fluids?
Not directly.
Likelihood of him having Ebola is very slim. But if he had Ebola, I'd be ready to go.